Hello everyone. Today I'm going to talk to you about your interpersonal skills score and how you can get a clear pass in this domain. So, as all of you already know, you are scored in three domains in the BLAP 2 exam. Number one is data gathering, number two is clinical skills or clinical management, and number third is your interpersonal skill score. Now, out of the three, interpersonal skill is the most vague, and people don't really have an idea what it means. Okay, a lot of candidates that I have talked to, they have this idea that interpersonal skill means that you just need to be nice to the patient. Okay, you just need to be polite. You need to say stuff like "I'm sorry to hear that." Okay, but today we will dig deeper into what IPS basically means and what the examiners have in their mind when they are marking you for the interpersonal skill scores. Okay, so basically, interpersonal skills is the first point that I need to talk to you is about demonstrating active listening and exploration of the cues. Okay, so before discussing this, let me tell you a bit about sympathy and empathy, because people keep on saying, oh, you need to be empathetic, you need to show empathy to the patient. Okay, but they don't really know what empathy means and how is it different from sympathy. So sympathy is basically you expressing your emotions to the situation of the other person. So for example, if a person is going through a lot of pain, so you tell the patient, I'm sorry to hear that, I'm sorry that you are feeling chest pain. Okay, this is sympathy. But empathy is basically listening to the other person, understanding their situation, and feeling the same emotion as the other person is feeling. Okay, you can express empathy by not even uttering a word. Okay, by showing to the patient that you are actually listening, you are understanding. Okay, and you are feeling what they are feeling. Okay, so to put yourself in their shoes, this is basically empathy. So the first point, that is demonstrating active listening skills and exploration of the cues, it shows basically your empathy. So for example, if a patient uh, presents to you with, for example, cough, and he tells you, the doctor, I have this severe cough and I'm not able to sleep at night because of this, and it's been there for the last 2 weeks. Okay, and the first golden minute where they tell you some stuff about their symptom. Okay, and then the candidate go on and do OD-para. And in the OD-para, they ask again, okay, so Mr. Smith, can you please tell me since when are you having this cough? Now, this is a repetitive question, and it shows that you are not really listening to the patient. Okay, so it means that you are not being really empathetic. All right. So when you demonstrate your active listening skill and you're jotting down the key point that the patient is telling you, your conversation become natural, it become more fluent, and there are no repetitive questions, and shows to the examiner that yes, you are actually listening. An exploration of the cues can be like verbal cues or non-verbal cues. For example, a patient is looking here and there during the conversation, not giving you eye contact. So you can ask, I can see Mr. Smith that you're looking around. Is there anything bothering you? Okay. Are you being restless? The patient is, for example, moving his limbs and showing anxiety. So you can verbalize that. Okay. All right. Or for example, when you tell a news to the patient, and the patient, there's sudden change in the expression of the patient, and the patient looks surprised. So you say that, I can see, Mr. Smith, that this has come as a shock to you. Okay, so this is basically the exploration of the cue. All right, encouraging the patient's contribution to the consultation. Now, this is the point which is most overlooked by the candidates. Okay, we don't, encourage the patient's contribution to the consultation, and we are talking and talking and talking, and it just seems like a really one way communication, where it needs to be two-way communication. It needs to be a shared, a shared plan, which brings us to the third point, which is developing a shared understanding and demonstrating an ability to work in partnership with the patient. Okay, shared understanding and demonstrating an ability to work in partnership with the patient. So please remember during a consultation that it's not only you who has to provide the management. Okay, it's not like, in some of our countries, where we just tell the patient that you are going to do this, and because of the lack of time, other problems like population, lack of resources, etc. But the UK is the first world country, so you have to, work in collaboration with the patient. Okay, it's not only, your management. It needs to be a shared management. Okay. So basically, when you are telling the patient, you are discussing a management plan with the patient. So you tell the patient that, Mr. Smith, you have this, for example, if the patient is of obstructive sleep apnea patient, you tell the patient that, Mr. Smith, so the main management for this condition is basically weight loss. So would you be interested in that? Would you be willing for me to tell you more about it? Okay. And then you go on and start discussing how to do, how to do the weight loss regime in the obstructive sleep apnea. So you tell the patient that, we can also help you with your weight loss by sending you to the dietitian. Would you be interested in that? Okay, so developing basically a shared understanding with the patient, so that the patient understands you, understand the management plan, and he's okay with all the management, and he really understands the management that you are providing to him. Okay, acknowledging and utilizing the patient's contribution to the consultation, including consent. Okay, acknowledging and utilizing patient's contribution to the consultation, including consent. So basically, you also need to listen to the patient and listen to the patient's contribution to the consultation, the patient's health belief, and the patient's agenda. Okay. So, for example, if a patient tells you that, doctor, I don't want to take antidepressant medication, so you can tell that, Mr. Smith, I appreciate that you don't want to take antidepressant medication. Can you please tell me why? Okay, and there is also another form of therapy, another form of treatment that is available, which we call as talking therapy, where you have to talk to a trained psychologist and they'll help you cope with your symptom. Would you be interested in knowing more about it? Okay, so basically utilizing the patient's contribution. It also means that a patient, whenever a patient tells you something significant, like, doctor, I don't want to go to the hospital because I don't really like going to the hospital, and that's why I presented late, because my father or my mother, they died at the hospital. Okay, something tragic. Or they tell you, no, doctor, my family member was diagnosed with cancer. Okay, so you need to acknowledge that and reflect back on that. Okay, many people, what they do, they just say, I'm sorry to hear that, and they move on to the next question and ask the patient, okay, so do you exercise? Okay, so basically, the patient usually shuts down with that. Okay, you are not acknowledging their contribution, you are not reflecting back on their experiences. So a better response would be, I'm sorry to hear that, Mr. Smith. It must have been really challenging for you. Okay, it must have been very difficult for you to deal with. Or, for example, a patient presents to you and he says, doctor, not basically a patient, a relative, the patient presents to you, and the patient has advanced dementia, and they says, doctor, my mom, she sometimes becomes aggressive and she shouts on me. Now, keep yourself in the shoes of that daughter whose mother has, all of a sudden altered personality, and she sometimes not recognize the daughter and she shouts on her. It's basically very painful for the daughter. So you tell her that, I can see, Mrs. Smith, that how much you love your mother and how much you care for her, and it must have been very difficult for you to see her that way. Okay, so it shows more warmth and more compassion, instead of, I'm sorry to hear that, and just jumping on to the next question without without reflecting it back to the patient. Okay. All right, then avoiding lecturing, unnecessary information, and long-winded explanation. This here is one of the reasons that many people fail. Okay, just the other day, somebody was asking in the group whether you need to tell all the details of the fluorescein angiography and optical coherence tomography to the patient with diabetic retinopathy. No, you don't. Okay, because if you go on discussing fluorescein angiography and stuff like that, the patient, well, he will be overwhelmed. Remember, your patient is not a doctor or a medical student, he is just a layman. Okay, so, and he has no interest in knowing everything about the procedure of fluorescein angiography. Okay, so please avoid lecturing. Okay, tell them their diagnosis in simple manner. Okay, simple words, For example, in obstructive sleep apnea, or for example, in dementia, you can tell him it is a condition of brain and it gradually deteriorates our brain. And initially the patient have some memory problem and slowly and gradually also cause personality changes. Okay, so basically in simple words, and avoiding any unnecessary information, don't tell about, the details of the procedures and stuff like that. Don't go into long-winded explanation telling them the thyroid functions test and T3, T4, and TSH, and full blood count and high resolution CT scan and stuff like that. Okay, be simple and be very clear to the patient. Okay, don't use any jargons. All right. Yeah, and then treating the patient with appropriate respect and sensitivity during the consultation. So this is basically, when you are for example, going for an examination. So you tell the patient that, I need to do this examination, and explaining the examination that I will check your observations that include your heart rate, your blood pressure, your respiratory rate. I will need to listen to your heart sound, your lung sound. So in explaining basically the examination that you are about to undertake, okay, and justify it, why you are doing it. Okay, so basically tell the patient, as you told me that you are chest pain, so I need to have a look at your chest and listen to your heart sound and lung sound, if that's okay with you. Okay, so this means appropriate respect and sensitivity. Also, if you are doing an intimate examination, for example, a pervaginal examination, or for example, the skin patient might have an ulcer on the genitalia. So, or per rectal examination, which is an intimate examination. So always offer a chaperone. Okay, so this means this shows that you have appropriate respect and sensitivity for the patient. Okay, so all right. Then exploring where appropriate patient's agenda, health belief, and preferences. Okay, so for example, if the patient tells you, doctor, I don't want to have any blood products, so please always explore, why do you want, can you please tell me why you don't want to have any blood products? And would you be would you like to have some components of the blood instead of the whole blood? Okay, and try to come up with some, if they have certain health belief, try to understand and explore them and provide alternative solution where appropriate. Okay, all right, and then the use of appropriate body language. So this just mean that giving eye contact to the patient, not looking here and there during your consultation. Many people, they try to, they either look up or they look down, trying to recall some of the, some of the notes or whatever they have studied. Please don't do that. Be present in your consultation. Okay, it's not about your notes. The examiner do not have any academic notes, and they're not checking with that. They have their own criteria. So and there is like no fatal mistake. I have seen people who have missed the diagnosis but still passing the station. So it's not about what's written in the notes, it's all about your consultation there and then. So please be present. Okay, and show appropriate body language, give your proper eye contact to the patient, keep your posture appropriate, do not cross your arms, do not cross your legs. Okay, if possible, lean towards the patient. If you are not listening properly, nod your head so that they can see that, yeah, you're actually listening. So that was all about interpersonal skills, and I hope it's more clear in your mind after this, and you get a clear path in your interpersonal skill domains. So this was all about IPS, and I will see you soon with the next video.